Hi everybody, and thank you so much for coming. My name is Jo-Beth Stamm, and I want to talk to you a little bit today about pediatric mock codes. So I've been a nurse for 10 years, and during that time I've asked myself what I wish I'd had throughout my career to help make me be the best possible nurse I can be for my patients and for their families. For me, the answer to that question is mock codes, and specifically pediatric mock codes. I put out a survey recently to those of you in the emergency department and had 20 respondents. So to those of you that answered, I want to thank you so much for your participation and for your time. There's two questions on that survey I want to discuss now. The first question was, how prepared clinically do you feel to participate in a pediatric emergency scenario today? So of those 20 respondents, 17 people said they felt somewhat prepared. One person felt very prepared, and 2 people of those 20 respondents felt somewhat unprepared. Now think a little bit about an emergency presenting to your department. It would be great if 5 nurses have the time to come in and be all hands on deck and help, but sometimes that's just not realistic. Sometimes you only have 2 or 3 nurses that are available to help with that emergency. Now what if of those 2 or 3, 2 of them feel a little bit unprepared to care for that patient? It doesn't set you up for the best patient success. And that's something that we can fix. The next question I asked was, how would you rate your stress level related to the idea of a pediatric emergency presenting to your department right now? 13 people felt that they would have a somewhat high stress level. 4 people felt that they would have a somewhat low stress level, and 3 people felt they would have a very high stress level. Now, I don't know about you, but I know that for me, when my stress level is very high, it clouds my thinking a little bit. It makes me a little slower to process things. And if my thinking is clouded, or I'm being slower to process things, I know that I'm more likely to make a mistake. And that's something that we just can't afford with pediatric emergencies. LifePoint Industries is the umbrella organization that's over top of Raleigh General Hospital. LifePoint Industries has asked the education departments in all of their hospitals to implement mock codes in any unit where there has not been a code in the previous 6 months. Now this is separate for adults and for pediatric patients. In our emergency department, we work adult cardiac arrest patients on a regular basis, so that's a non-issue for us. Luckily, we do sometimes go 6 months or greater without seeing a true life or death pediatric emergency or having a pediatric death in our department. Since pediatric emergencies are low occurrence, they are also very high risk. Now, we recert our pediatric advanced life support certification, our PALS certification, every 2 years. But studies have shown that practicing those pediatric resuscitation skills every 2 years is simply not enough. We need to do that more often if we expect to maintain competency. And that's what brings us to where we are now, mock codes. So in hospitals in which mock codes have been implemented, they've shown a number of benefits. First, staff confidence during emergencies has improved. Staff clinical competency has increased. And the reported stress levels that staff experience during emergencies has gone down. So again, it goes back to that clouded thinking. If your stress level is lower, you can think more clearly and you are less likely to make a patient error. System problems have been identified and corrected. So what do we mean when we talk about system problems? System problems could be something as simple as not having easy access to the size equipment that you need to take care of that pediatric patient. It could mean needing to call up to pharmacy to have a critical medication that you need right now mixed up and brought down, and that causes a delay. So when we can identify these system problems, we can fix those and we can mitigate those issues. And finally, and most importantly, there we go. Morbidity and mortality rates of pediatric patients decreases when you implement these mock codes. Guys, practicing this, doing these pediatric mock codes, practicing our skills could literally be what makes the difference in saving the life of a child. So what to expect? What's coming? First, we're going to implement mock codes. So what do we mean when we talk about mock codes, guys? This doesn't necessarily mean we're going to be doing a mega code with CPR in progress. A mock code is practicing an emergency scenario. It could be a respiratory scenario, it could be trauma. It's going to change. We're going to be doing these on a quarterly basis, so at least every 4 months you're going to see the education department, me, your emergency director. We're going to be coming in and doing these mock codes on your shift, and that's going to be across all shifts. It is going to be unannounced, at least for the first one. I'm telling you now to expect it, but you're not going to come in at the beginning of your shift and be told that you're going to be doing a mock code on that shift. We will show up in the middle of your shift with a mannequin, tell you we have an emergency, and our scenario starts right then. They will be short. This isn't going to be a 30 or 45-minute situation. We are shooting for no greater than 10 minutes for the actual scenario, and we're going to be following it by a short structured debriefing, and we're shooting for no greater than 5 minutes on that. Guys, we are aiming for slow times. One of my big concerns when we looked at implementing this was that we would stress the department at a time when every bed is full, every nurse is overwhelmed. We're going to be doing everything that we can to prevent that from being an issue. So we'll be communicating with your charge nurse. We'll be making sure that we're not going to be coming in at a time when this is going to cause detriment to patient care. Guys, the scenarios may vary. As I said earlier, you might see a respiratory scenario, maybe a trauma, shock, and yes, you might see a full cardiac arrest. And we will be varying those with the season. And last, treat as if it's real. When we walk in with this mannequin, it's you're calling for help for an emergency you have coming in right then. You're calling for other staff to come assist you. If the patient needs an IV initiated, don't just tell us and say, okay, yeah, I would initiate an IV. Instead, I want you to get the supplies that you need. I want you to bring those to the bedside. Go through it in as realistic a fashion as you can. If you need a piece of equipment that's in a completely different room, let everybody else know you're going to get that. Leave the room, go find it and bring it back. This is part of us finding those system problems, is knowing how long does it take to go about this process? How long does it take to get the equipment that you need? So treat it as if it is real. Folks, what this is an opportunity. This is an opportunity to practice in a safe environment. It's an opportunity to practice on a patient for whom, if we make a mistake, no harm will have occurred. And it is an opportunity to learn from one another. And this point is very important for me. This is not a test. We are not judging you on this. There are no merit raises or anything like that that will be based on this. We are basing nothing on your performance within these scenarios. Now, you might come out of one of these scenarios and say, hey, I think I need to go home and brush up on these certain situations, and that's great. But we're not testing you. So folks, the best way to make this happen is to go ahead and make it happen. Now, initially, we planned on an implementation of the end of March to beginning of April. Unfortunately, due to the COVID-19 pandemic, of course, a lot of things have been changed. So at this time, we do not have a definite date for implementation of this program. We are shooting for mid to late summer of 2020. Just know that shortly following the resolution of this pandemic is when we will be implementing this. I feel, along with the other members of our Change Project Committee, that right now, when everyone's stress levels are high with this pandemic occurring, is not the best time for learning. So we do want that to resolve and give you guys a chance to really get the most out of this that you can. Folks, if you have any questions about anything, I have a great deal of literature I'm happy to share with you. I'd be happy to give you my sources or talk to you further about this. And thank you so much for your participation. Please let me know if you have any questions. Again, my name is Jo-Beth Stamm, and I'm excited about this project. I hope you are as well. Thank you.